Viewing or listening to this podcast confirms acceptance of the disclaimer visible on your screen or found at authorscott.com/podcast. Welcome to the Regaining Health and Humanity podcast. I'm Dr. Scott Johnson, your guide on this journey to natural well-being. Here we explore evidence-based insights, revolutionary breakthroughs, and powerful health strategies that not only inform, but inspire change. Together, we'll uncover the mysteries of human existence and unlock the secrets to thriving. This podcast is more than just knowledge. It's your catalyst for unleashing extraordinary potential. Get ready. Your journey to boundless health and happiness starts now. Hello, friends, and welcome to the Regaining Health and Humanity podcast. I'm your host, Dr. Scott Johnson, and I'm happy to have an opportunity to share an important topic with you. Considering the vast majority of my audience are female, I wanted to have an expert come on the podcast to discuss breast health, which surveys say is a significant concern for many women. So I've invited renowned breast surgeon and breast care expert Dr. Jenn Simmons to the show. Dr. Jenn is the author of the best-selling book, The Smart Women's Guide to Breast Cancer, hailed as a must-read for anyone navigating this challenging journey. As the host of the insightful podcast, Keeping Abreast with Dr. Jenn, she shares her expertise and passion for holistic health. At Perfection Imaging, Dr. Jenn is leading the charge with safe, affordable, and radiation-free breast imaging. Committed to addressing the needs of the forgotten woman, she educates on the safety and benefits of bioidentical hormone replacement therapy for breast cancer survivors, forever changing the landscape of breast health. Welcome, Dr. Simmons.
Thank you. Thank you so much for having me.
Well, like I said in the introduction, a significant number of my listeners are female, so I think this is going to be a topic that will apply to them and that they'll be excited to hear.
Well, I'm happy to be here.
What I want to start out with is, what are the key lifestyle and dietary factors that contribute to maintaining optimal breast health from a holistic perspective?
The bottom line is, at the end of the day, breast health is health. And the very same things that are going to give you a healthy breast is also going to give you a healthy heart and healthy brain and healthy bones and healthy joints and healthy skin and healthy mood and healthy sexuality. I mean, we're all one system, right? So the things that I talk about with people, if you want to have breast health, then you need to be eating a nourishing diet, a whole food diet. So the kinds of things that I talk about are eating a whole food, plant-based, low glycemic diet. That does not mean that you have to be plant exclusive, but I do believe that our nutrients come mostly from plants. And I also advocate for a grain-free diet. I know that that is like heresy to a lot of people because they grew up during the time of whole grain goodness. But the truth is that we as humans have no nutritional need for grains. And if we never had another grain again, we would suffer no nutritional deficiencies. So for me, it's hard for me to tell someone to include something in their diet that they don't ever need. I think that there is an element of bio-individuality, and what's good for me is not necessarily good for you, and vice versa. And there's a big difference between men and women. I don't think that men and women should be on the same diet. So it's really for me about eating in a way that is nourishing, but is also evolutionarily correct and supports what you need. And then, as important as it is what you eat, it's also important what you don't eat and when you eat and how you eat, right? Because if you're eating in your car or on the run, you're not able to receive those nutrients because you're not in a state that can receive them.
Right.
And I think that the fastest way to healing is through fasting. And I think everyone should be doing some kind of fasting. And so on a day-to-day basis, you should have at least 12 hours between when you have your last meal in one day and when you have your first meal in the next day. And those fasting times change depending on the time of the year, where you are in the world, because we are tied to circadian rhythm.
Mm-hmm.
We are creatures of the sun and the moon. And so we need to be mindful of what time of year it is and what time of the day it is, because our digestion is pretty good in the morning. And then as the day goes on, we become less and less efficient at breaking down food, at absorbing food, at metabolizing food. And so we need to plan our eating accordingly and be respectful. So during the winter months, when we don't have the same daylight hours, our eating window is shortened and our fasting window is lengthened. And during the summer months, that changes. This is how we survived from a biologic standpoint. If we were able to gain weight during the summer, then we were able to make it through the starvation of winter, right? Only we don't have winter anymore. So, everyone is running around like it's summer and eating like it's summer all year long.
Mm-hmm. Right.
So I think we need to get back to the basics a lot more and be in alignment with the sun, with circadian rhythm, and with how nature intended us to be nourished. And then, of course, movement is extremely important, right? We are nomadic people. We're meant to be on the go. We had to forage for food. We had animals to run from. I mean, we're meant to be on the go. So if you don't use your body, if you don't move your body, you lose your body, right? So movement becomes really important, and movement changes over time. We can tolerate lots of cardiovascular exercise when we're young, but as we start to get older, we become less tolerant. And every time we move, right, when we exercise, we are burning fuel and creating the byproducts of fuel. So even exercise to some extent can be inflammatory. So the kind of exercise that we can do and tolerate and that's good for us as we age changes, because we no longer have so much tolerance for those byproducts for burning fuel. The other thing that changes as we get older is that we start to lose muscle mass, and our fat to muscle mass ratio starts to change. And our muscle mass is actually the key to metabolic health. And breast cancer is a metabolic disease. There are lots of disease states like cardiovascular disease and diabetes. These are all metabolic diseases. And the key to metabolism is maintaining that muscle mass, because that is what's going to give you efficient metabolism, and that is what's going to dictate metabolic health. As we age, we need to lift heavy things. We need to do the things to maintain muscle mass or even build muscle mass. And as it turns out, bone follows muscle. So if you're worried about osteoporosis, get in the gym and lift heavy stuff. We have to talk about toxins and your toxic load, your allopathic load that you can tolerate, because as you start to fill that toxic bucket up, eventually it's going to overflow, and the overflow means disease. So cleaning up the environment, being aware of what is around you, what you're putting in, on, and around you, that ends up being really important. And also having detoxification practices, getting in that sauna and getting real sweat going, making sure that your elimination pathways are open, that you are moving your bowels once, twice, even 3 times a day. This is a major way in which we eliminate toxins. I think about all those women that are on birth control pills to prevent them from menstruating. Well, menstruating is a major, major way that we get rid of our toxins every month. So if you're blocking that process and preventing that process from happening, you're actually interfering with your health. Sleep is where the healing happens, right? If you're not sleeping, you're not healing. So prioritizing sleep, we have this stigma of people that value sleep, right? They're stupid or lazy or whatever you want to call it. These are actually the people that are smart. because this is how our body heals. And if you're not sleeping, and we see this in populations of people who are shift workers or insomniacs, short sleepers, all of these people, they suffer with 20 to 30% more chronic disease than the population of people that don't work these off hours, or the population of people that sleep at night. So we know that sleep is tremendously, tremendously important. Managing stress. So, you know, we are built to be in that sympathetic fight or flight state for about 5% of or less of our day, right? We are modern beings living on a very old gene code. And so we only understand two states, right? We understand safety and we understand danger. But the danger that we understand is very primitive, right? It's run away from a saber-toothed tiger. It's not, oh, I have a job deadline. I gotta do carpool. There's terrible traffic. Like, we don't understand this. So we have the same response. Flood the system with cortisol so that it can run away from the tiger, right? Only our stressors now are not tigers, and we're not running away. We're sitting in our chair dealing with our stressors, bathing ourselves in cortisol, which is disturbing our metabolic health, which is weakening our bones, weakening our muscles. We get muscle wasting. Like, we have all of this inflammatory cascade that's kicked off, and it's not only 5% of our day. For most people, it's 40 to 50% of your day is spent in this cortisol driven state. And the stress isn't going anywhere. And our body is not going to evolve quickly enough to figure out that your life is not in danger because you feel stressed, right? So what we need is things to manage this. And we do have the ability to control the effect that this is all having on us, but you have to build the tools, right? You either need a meditation practice or a breathing practice, or you need something to be in charge of what we allow to affect us. We're always going to default to that primitive cortisol driven state, which is just going to lead to more disease. So we have to manage stressors. And then the last thing, which I think is probably one of the things that people struggle with the most, is that we were all put on this earth by God with great purpose. And no one's purpose is more important than the other one, right? Like, we need everyone doing what they were meant to be doing here and living a purpose-driven life. Only most people are only walking through their life and don't relate to that, don't see it. And so when you live without purpose, you're not really living. And it oftentimes takes a crisis, like a breast cancer diagnosis, to really discover what your purpose is. I mean, I know that that was true for me. Yes, I was a great surgeon and really helped the people that I was working with one-on-one. But it wasn't until I became a patient that I realized that my purpose is so much greater, because I wasn't meant to help a couple thousand people in this life. I was meant to help millions and millions and millions of people in this life. So living with purpose, living your purpose, this is really important in preserving your health. So yeah, that.
Yeah, those are all great suggestions, and actually it feels like I'm going back to my very first episode where I shared many of those same points, just to live a healthy lifestyle. I want to briefly have you discuss some risk factors that women should be aware of and how these inform decisions about screening and preventive measures.
Yeah, so it's a great question. And I don't so much think about risk factors the way that we are taught in medical school. So in medical school, we're taught that the risk factors for breast cancer are things like early menarche, like having your period at an early age, and late menopause, not having children before the time that you're 30, not breastfeeding. So I don't think about those things as much as I think about what are the drivers of breast cancer, in that what are the things that are causing chronic inflammation in our bodies? What is driving disease? So when I think about the causes of breast cancer, I think about things like chronic inflammation from your diet. And yes, sometimes it's from a processed food diet, and sometimes it's from a diet that you think is good for you that's actually not good for you. And I can give the example of, for many, many years, I was a vegan. And from a genetic standpoint, that diet is not good for me. And I was a non supplementing vegan, even though I was a whole food vegan. And so I couldn't make my own vitamin A, and I didn't know this. And even though I was eating things that I thought were rich in B12, it wasn't nearly enough. So I got into a lot of trouble. So you can be inflamed from your diet, even with a diet that you think is quote unquote healthy. So chronic inflammation from the diet, sedentary lifestyle, which we already talked about because it's a very inflammatory state. And also, when you're sedentary, you're not moving toxins through your body, you're not oxygenating your body, you're not circulating toxins around, you're not getting rid of them. So sedentary lifestyle is a risk factor for breast cancer, and also overexercise. People that are overexercising are building up too many of those toxins as they burn through fuel. Think about the endurance athletes. We are built to run away from a saber-tooth tiger, but for like 15 seconds, and not for 3 hours or 3 days or 3 weeks or 3 months or 3 years. So people who are over-exercisers are just telling their body that they're in constant danger. Radiation exposure from repeated mammograms or x-rays or radiation in childhood. Radiation is a known carcinogen. And I am very adamant about the fact that I do not use mammogram to screen for breast cancer, because the one sure way of getting breast cancer is to radiate your breast every year. Right? We know that radiation causes cancer. So why would I use a test that causes cancer to screen for cancer? So I am very aware of radiation and try to avoid it when I can at all costs. Chronic diseases, chronic inflammatory states like obesity and diabetes and thyroid disease and celiac disease, inflammatory bowel disease, MS, these all increase your risk of getting breast cancer. Chronic infections like viruses, fungus, mold, Lyme, parasites, yeast, all of these cause chronic inflammation and can increase your risk of getting breast cancer. Heavy metals, which we find in our drinking water, in our soil, in dental amalgams, in food, in cosmetics, these all can directly damage cells, and they can also cause inflammation. Chemical exposures, things that we consider xenoestrogens. So these are chemicals that their compound looks like estrogen, and they can attach to the estrogen receptor, but stimulate in a very dangerous way. So I'm talking about things like plastics and pesticides and herbicides and fungicides and preservatives, all of these xenoestrogens. Chronic antibiotic use. Every single dose of antibiotics that you take increases your risk of getting breast cancer. So I am not telling people not to use antibiotics. Of course, I wouldn't say that. But antibiotics are reserved for times when you have a bacterial infection, period. We're not taking them for viral infections. We're not taking them prophylactically. The other thing that I'm seeing so frequently that we're not talking about enough is chronic dental infections or cavitations. So I believe that anyone with a history of dental work should see a holistic dentist and get a cone beam CT of their mouth, because if you still have metal amalgams in your mouth, they need to go, and there's a particular way to remove them. It's called the SMART method, where you protect yourself from the mercury that is released at the time that you have your amalgams removed. But if you've had a root canal, you actually have a dead tooth in your mouth. And so this is something that We definitely want people to not have something dead inside of them because it's just going to collect bacteria and cause a lot of chronic inflammation. That also goes for people who have had wisdom tooth extractions because it causes inflammation year after year after year. And eventually you might come with a breast cancer diagnosis, not even knowing that that was the source of the inflammation. Frequent toxin exposure is one of the major ones. And I think mostly about alcohol because alcohol consumption has been so normalized in our society. And yet it is probably the biggest modifiable risk factor for breast cancer.
Mm-hmm.
So don't shoot the messenger. The American Cancer Society says that there is no safe amount of alcohol for women, no safe amount. I feel pretty strongly that if you are postmenopausal and you are on hormone replacement, you should not be drinking alcohol at all.
Mm-hmm.
If you have an occasional drink or glass of wine, is it going to cause breast cancer? No, probably not. Right? But I don't think it should be a regular part of anyone's routine. And smoking definitely increases the risk of breast cancer. And I don't recommend anyone smoke for any reason ever. Chronic constipation is one of those things that I also think we don't talk about enough. And this a way that we get rid of our toxins, right? Especially it's a way that we get rid of our estrogen after it's been metabolized. And so many people, I ask them, are you regular? And I learned very early in my career that you have to be more specific than that. Because lots of the time, if you ask someone if they're regular and they say yes, and then you ask them what that means, they go every week.
Yep.
Right? And so we definitely have to be more specific and ask, do you go every day? Do you go every time you eat? Because we should be like babies and dogs. We should go every time we eat. So making sure that you are, first of all, eating a diet that is fiber rich and getting enough hydration. But, sometimes people need more help than that until their gut gets into the habit of doing this. So magnesium and vitamin C and things like that will help people to get started, and hopefully you can then maintain that. We talked a little bit about insomnia, chronic sleep deprivation, short sleepers, night shift work. This is all in the same genre. If you're not sleeping, you're not healing. And sleep is where the healing happens. So we need to make sure that we're doing that because otherwise it puts you at increased risk of getting breast cancer. Being overweight for a whole host of reasons, but it is a very inflammatory condition. So being overweight is a risk factor for breast cancer. And that is probably what I would consider the second most meaningful modifiable risk factor for breast cancer. I put that under alcohol consumption because I think it's easier to not drink than it is to optimize your weight. I love ice cream. I love birthday cake. I just know that it doesn't love me, right? And I want to love myself more. The electromagnetic field is a big one. We definitely don't talk about that enough. EMFs is really an invisible toxin that is surrounding us, that is causing cellular damage and leading to breast cancers amongst other diseases, many of them. Unresolved trauma. Like if we don't resolve our trauma, it is going to present as a physical symptom. And a lot of the time, this is the root cause of breast cancer for people, is that they are reliving this trauma over and over and over again every single day. Chronic stress from a difficult relationship, a bad marriage, a horrible boss. I mean, I tell this story all the time where my friend Susan had breast cancer and got treated, and 2 years later, she had a recurrence. And I'm like, oh, this is devastating. I'm so sorry to hear. And she underwent treatment again. So treated for breast cancer twice in 2 years. And then I saw her 2 years later and she was like unrecognizable. She lost weight. She looked vibrant. She looked amazing. I said to her, "What happened? What did you do?" And she said, "I had a husbandectomy." So, sometimes you need to get out of that relationship, that marriage, that job, that whatever it is that is weighing on you and bringing you down. And then being a caregiver to a sick parent, a spouse, a partner, God forbid, a child, right? Like this takes its toll on us. Divorce, job loss, unwanted move, like these are major traumatic events in people's lives, and it does take its toll. We talked about building your resilience because all of these things end up really mattering. And I know that this is a big, exhaustive list, and I don't expect anyone to be able to go through this by themselves or work through this alone. This is one of the major reasons why I wrote my book, The Smart Woman's Guide to Breast Cancer. And it's not just for the person that has breast cancer, right? It's for the person that is also at risk or they had breast cancer and they're trying to figure out now what. So this is a tool that can show you not only what you need to know in the conventional medical world and how to approach it, but also it is your pathway back to health. And for many women, it's knowing health in a way that they never, ever knew before their diagnosis.
You mentioned mammography earlier, and that's one of the things that I really wanted to touch on during this podcast is there's been a lot of discussion about mammograms and their effectiveness lately. The research conducted by organizations without a conflict of interest identify substantial problems in the randomized trials supporting their use as a screening tool. Some studies have found breast cancer is overdiagnosed by mammography by 20 to 52%, and it doesn't really lead to saving lives. So can you explain the differences between thermography and ultrasound and mammography, and what are the pros and cons of each?
Absolutely. Absolutely. This is one of my favorite things to talk about. And you hit the nail right on the head in that the organizations that have done the studies that do not have a financial interest in mammography have all come to the same conclusion. And that's that mammograms, at least from a population standpoint, do not save lives. So when our mammographic screening program started in the 1970s, it was founded on this understanding that breast cancer growth was both linear and predictable, so that if you found something small before it reached some critical size, at which point it would metastasize, then you could save lives and save breasts. And it's logical and it's a lovely theory. It just doesn't happen to be true. Breast cancer is what it is from the very beginning. And if it's going to be aggressive, it's going to be an aggressive process. And it doesn't matter what size you find it at, right? It's all about biology with breast cancer. And we have known since 1977 that mammograms do not work, that mammograms do not save lives. And yet it was something that people wanted. And we were fed this narrative and we believed it. And we continue to believe it until today. And so the major studies that I go to the Cochrane Review, which is a completely unbiased organization. And they looked at the Swedish trials, and 600,000 women, half got screened with mammogram, half did not. And they all have the same access to the same kind of care. And what they found is that the same exact number of women die of breast cancer in both groups. And the only difference is when you use mammogram to screen, you're going to diagnose 20 to 30% more cancers. Now, to put that in a little perspective, we diagnosed 300,000 cancers in the United States last year. If 20 to 30% of them are overdiagnosis, meaning that these are just findings that we found on mammogram that would have never become clinical disease, we're talking about 60 to 90,000 women treated unnecessarily for breast cancer. If breast cancer treatment were benign, that would be one thing. But breast cancer treatment is anything but benign.
For
And
sure.
the way that we are leaving women after breast cancer treatment is far worse off than they were before. And they are really suffering, and we are shortening the duration and decreasing the quality of their life. And even the chief medical officer of the American Cancer Society, Dr. Otis Brawley, recognizes the need for accepting the limitations of mammography screening, and he acknowledges the existence of breast cancer overdiagnosis and states that it totally challenges the value of screening. And it means that the benefits of breast cancer screening have been completely overstated, and that some women who have been quote unquote cured were actually harmed because they were treated for breast cancer unnecessarily. So I do not use mammogram for screening ever, because there is no benefit to doing it. So that means that there are only harms. And we know for every 2,000 women that are screened with mammogram over 10 years, you can maybe save one life, and you will cause anywhere from 10 to 50 women to be treated for breast cancer unnecessarily. These numbers do not work. They do not work. So what do we do for screening? I believe that every woman should be doing self-breast examination. We saw in the studies that the difference between the cancers that were picked up on mammogram as compared to the cancers that are picked up on physical examination, there's only a 5 millimeter difference. So physical examination is very meaningful and very valuable, and no one is ever going to know you better than you know yourself, right?
Yeah.
And every woman thinks her breasts are lumpy. So just own your lumps. Know what your breasts feel like when they're normal so that you can know what they feel like when they're abnormal. So that's the first thing. The second thing is I'm using something called the ARIA test. It's the tears test. This is a test where you take a little piece of litmus paper and it just goes right inside of your eyelid. Close your eye for 5 minutes, take the paper out, send it off. It's not painful. It's very, very easy. Anyone can do it. It's a test you do at home. And this looks for two proteins that are inflammatory proteins that are associated with the very, very early stages of breast cancer. So they look for the S100A8 and S100A9 proteins. If you have a critical amount of these proteins, we know that you're at increased risk for breast cancer and you need to go get imaged, right? But if you don't have these proteins present, the likelihood that you have breast cancer is nearly zero. So you're good. And that's your screening. You're done. And still people want imaging because they want a picture, they want more, and we've been conditioned to image. So what I suggest people do is they have a QT scan. So a QT scan uses sound wave technology transmitted through a warm water bath. So in a 20-minute spa-like experience, we collect 200,000 times more data points than MRI and create a true 3D reconstruction of the breast. Now, there are only 7 centers in the United States. I'm putting up an additional 8 this year, and I am making it my life's mission to make sure that everyone who wants access to this technology gets access to this technology. My centers are called Perfection Imaging, and I can assure you it's coming soon to a town near you. In the meantime, you can have an ultrasound. Will an ultrasound pick up every single thing that a mammogram will? No. It will pick up different things, but it will pick up the important things. And that's what this is about. I know that doctors insist that you get a mammogram. They don't want you to have an ultrasound unless you've had a mammogram. What I suggest to people is have a good relationship with your doctor. Have them have an agreement between you. You are holding them harmless for anything that might be missed by not getting a mammogram, so that they know that you're not going to come after them, because ultimately that's really what they're afraid of. I do not use thermography to screen for breast cancer because that's not what that tool was designed for. It detects a heat signal, so it's great to find inflammation. And if you are looking for a source of inflammation and can't find it, go get a thermogram, right? Find out where that inflammation is coming from. But I don't use it as a screening tool for breast cancer because it's not reliable. I don't use things that I can't count on. And so, that's my screening paradigm. I have everyone doing self-breast examination. I have everyone doing the ARIA.care test. So it's AURIA.care. And if you use my code DrJenn20, DRJENN20, it will give you 20% off. It's like a $130 test. It's very, very affordable and very reliable. And then if you want imaging, QT scan at Perfection Imaging or get an ultrasound.
Yeah, that makes total sense and sounds so simple to be able to just do that ARIA test in your eye, and then you don't have to worry about it. I think we just have to re-educate the average woman and say, yeah, we've been conditioned to think that we always need a picture to prove something, but we don't. There are biomarkers, like you're talking about, the proteins that will allow us to get that same picture without actually having to take a picture. The last question I wanted to ask you is, if someone listening to this podcast could take just one step today to improve their breast health, what would you recommend?
Yeah, our biggest exposure to the outside world is through what we eat and what we drink. So, in as much as you can eat real food and drink clean water, that will go a very, very, very long way for you. If I can add a second thing to that, I just spoke about this at A4M, the American Academy of Anti-Aging Medicine. If we screened for metabolic health with the same vigor that we screened for breast cancer, we would all be way better off. And I think that everyone should know what their fasting glucose is, what their fasting insulin is, what their C-reactive protein is, what their waist to hip ratio is, what their triglycerides are, and what your HDL is, and your blood pressure. If you know all of those things and all of those things are normal, you're in good shape. And if they're abnormal, you need to do your damnedest to get them to be normal, because metabolic health is the key to health. And if we eliminated metabolic disease, we would eliminate 80% of the breast cancer diagnoses. 80%.
Yeah, I think you're not overstating when metabolic health is so important in today's society. There's emerging research even showing that that has a strong link now or association with Alzheimer's disease and dementia. And so there's a couple of things that I'm always telling people that are two of the most important things for you to be aware of and to be managing if you want to be healthy. And one is metabolism and two is inflammation, and they are closely interrelated. So I totally agree that those are things that we should be looking at on a regular basis and always knowing our numbers so that we know what kind of health that we're in. So I really appreciate you, Dr. Jenn, for coming on. It's been very enlightening, and I think that you've shared a lot of good information that women can now take and go and talk to their healthcare professionals, their providers, so that they can get the correct screening that is going to lead to a proper diagnosis or not diagnosis without having harm caused, and just following the same lifestyle factors that we follow in order to keep ourselves healthy. We're also going to support breast health in the same way.
Absolutely. Absolutely. And I hope that we as providers make this point more and more often, because I really believe that we need to prioritize metabolic health, and people need a tremendous amount of awareness around it. And the more aware we are, the more disease is going to go away. And that's our goal at the end of the day, right? Like, I would love to retire.
Sure.
I would love to not be needed.
Yeah, that's great. I totally agree.
Yeah. Thank you so much for having me today.
Thanks for being on. Thank you for sharing your time with us today. I hope you've gained insights to elevate your health and life. For more transformative evidence-based wisdom, I invite you to explore my 20-plus books at authorscott.com/shop. Don't miss out on the chance to supercharge your health and guide others to a better life. Like, share, and subscribe to join the movement transforming lives. Here's to your journey toward boundless health and happiness.